So tell me about gum grafting. What's involved?
Well, there's basically two types of gum graft, right? There's the type where we might just be making the gum thicker, and you can think of that as functional, right? If you have, say, a pair of pants without a hem, it starts to run, right? Well, the gum, if it's very thin, and that's quite often after, say, orthodontic cases, they've been expanding the arches, trying to line up teeth, the gum can get thin. Or if you're a heavy brusher, you might have worn down the gum margin. So thickening that gum up can help prevent recession. So that's kind of the first approach. But if there's a recession and we actually see it and don't like the look of it, like say you smile and it shows, then there's kind of a cosmetic procedure that we can use to cover the root back up. So as far as the procedure goes, we have a couple of different choices, but you elevate the flaps, you make a little, what would be like a little incision in the gum, and lift the gum back, condition the root, so cleaning the root basically. And then you take some gum either from the roof of the mouth, or you could use donor product as well, which is basically skin graft, the same stuff they use in burn centers. Typically, though, in my hands or my opinion, your own tissue works best, and usually there's plenty of it that we can get.
So you kind of transplant from one area to the other.
Yeah.
For those big receded gums.
Yeah, and it used to be that we had to leave an open wound in the roof of the mouth, and so if you had someone who had grafting done, say 10 or 20 years ago, they would say, "Oh my goodness, that was terrible. It really hurt." But today we use an incision technique where we basically make like a paper cut, take what we want, and close it back down again. So patients tell me that the stitches are the thing that bug them the most, and if I say, well, if the stitches bothered you and that was all the bad part of the story was, then that's pretty good, because it means it didn't hurt that much. And so typically it's a 1 or 2 day pain meds. You're off work for maybe a day or two, and if you're doing public speaking, like for you, for example, you might be a little bit longer, just because the movement sometimes gets a bit uncomfortable at the end of the day.
So with people with hot and cold sensitivity because of receding gums, how soon can that go away?
Well, it's tricky to say, because if you get 100% coverage on the root, then it would probably be gone away that week. But getting 100% coverage on a root is not a given. And even all techniques, and even the wizards out there that are promoting these procedures, there might still be a small portion of the root that's exposed. And the strange thing about recession and sensitivity is even a small amount can create a lot of sensitivity. So there's, you would do that as your first effort, and if you still had sensitivity, you might have to do some, say, root conditioning or bonding agents to help seal off some of those sensitive areas there.